Heartland Collaborative, and I want to welcome everyone who is on with us today for this webinar, Individual Healthcare Plans, What is Your State Doing? Most everyone should be on mute right now. I will unmute everyone when we have questions and discussion times, and I'm going to turn over the remainder of the webinar to our two presenters, Heather Smith and Melanie Baxter.
Thank you, Shona, and welcome everybody to the Individual Healthcare Plans, What is Your State Doing webinar. Today, our presenters are going to be, as Shona mentioned, Melanie Baxter with the Heartland Genetics Collaborative and myself, Heather Smith, with the Kansas Department of Health and Environment. Melanie, would you go ahead and introduce yourself so everybody knows who you are?
Sure. Hi, this is Melanie. As Heather said, I've been with the Heartland Genetics Collaborative for a little over 4 months, serving as project coordinator. So I haven't been with the Heartland very long, but in this short time I've been involved in a number of projects, including the one that we'll be discussing today. I'm a genetic counselor by training, so I'm currently also practicing cancer genetic counseling in the Cape Girardeau, Missouri area. And I apologize, it's that time of year, so I'm recovering from a cold, so I really hope it doesn't hinder anybody understanding me. But I'm really glad everyone's here, and I thank you for your time.
Thanks, Melanie. And my name is Heather Smith. I'm the health planning consultant for the Children and Youth with Special Healthcare Needs program here in Kansas. And over the past 3 years, I have coordinated, my primary role has been to coordinate a federal grant that focused on addressing the needs of youth with special healthcare needs aged 14 to 26. And that really, the focus was really on transition to adulthood. But part of that project consisted of looking at how do you integrate health in all aspects of the youth's life, including transition and school life. And so today we'll be discussing some of the outcomes of the grant with you as we begin to talk about individualized healthcare plans. That'll also provide us some background for some new initiatives that we're here to share with you today within the Heartland Genetics Collaborative. So our hope today is that this webinar will be, we'll have really valuable discussions and have an opportunity to learn about what is happening in each of your states. It looks like we have pretty good representation around our Heartland region, so we hope to learn something from each of you today. And before we get into that discussion, and we really want this, again, like I said, to be a discussion, so we really want your feedback and you guys to participate. We hope this will be a very interactive experience for you. But we want to make sure that we're really on the same page and share with you where we're coming from and what activities have occurred as we move into that new initiative. So today we want to actually start out by getting to know a little bit about each of you and to find out what roles you play within your community, and that'll really help us drive some of the discussions throughout the webinar. So Melanie, if you want to go ahead and launch our first poll. With each poll, we'll give about 20 to 30 seconds for you to choose your answer or make your selections. So in this particular poll, we'd like you to share with us if you are familiar with individualized healthcare plans or an IHP. So we'll give just a few seconds to let everybody answer that question. Okay. Well, looks like we'll go ahead and close the poll, and I believe we can launch those answers so everybody can see how that the breakout was. But it looks as if we had actually more people that did not know what an individualized healthcare plan is, which is a good thing because you'll learn about that then today. So thank you for that, Melanie. So the next question that we have is another poll, and it's really to find out how many of you are directly involved in the process. So out of the 38% of you that answered yes, you were familiar with them, I guess we already know that everybody that's not familiar with them probably isn't involved directly in the process. But if you want to, oh, sorry, Melanie.
I'm sorry. Yeah, I'm sorry. This is Melanie again. So I think the questions got flipped. So the attendees just answered if they were directly involved. I'm sorry, that was my fault.
Oh, okay. No, that's okay. Well, then we'll go ahead and move forward then. Sorry about that, guys. So the next then, we'll go ahead and go to this one if we could, and that is, what is your primary role in working with children with either genetic conditions or special health care needs? And this, again, will give us an opportunity to figure out how we want to move forward with discussions throughout the presentation. So again, we'll give about 20 to 30 seconds to identify who everybody is on the webinar today, and we will close that poll here shortly. Okay, it looks like most everybody has voted, so we'll go ahead and close that poll. And it's actually really exciting to me. We have a good representation from all of the different practice or disciplines that we were hoping to be on the call today. So we're very excited that all of you guys are here. That I think will really make the discussions very rich later on into having everybody's different perspectives. So thank you for participating in our polls. And we will have a few more of those scattered throughout the presentation just to give us an idea of your guys' experiences throughout the presentation. So, okay, so I guess now on to the business side of things. We want to begin really by sharing what the definition of an individualized healthcare plan or an IHP. You'll hear me refer to it probably as an IHP throughout most of the presentation. And this definition that's on the screen is actually from the Kansas Guidelines for Educators, School Nurses, and Parents. And so this is what our school staff use as their definition most likely, more often than not. But really this definition can be different in every state and even from school to school. So this definition is it's fairly broad, but it really talks about a plan that's developed by school professionals in conjunction with their parents or, as they put it, lawful custodians. But it's really about engaging multiple people to create a plan that addresses any and all healthcare needs for students within the school day. An IHP can also be tied directly to an individualized education plan or an IEP, or an individualized family service plan, which is an IFSP. Again, those terms may be different depending on the state that you're in. But essentially what the purpose of an IHP and what an IHP really is about is really making sure that the needs for the medical needs or the health needs of the student are being addressed during the day. And that's, again, really for anybody that has those needs. So the next poll we have here is about who is involved with developing an IHP. So we'd like to know, in your experience or at the institution or the school that you work in, who is generally involved in that process? Looks like the poll has begun, so if we could get everybody to sign in or log in your answers. And we know some of you are not involved directly with an IHP, so that this may be a question you may not be familiar with or you may not know the answer to in your state, and that's perfectly fine. Okay, looks like we have a good amount of people that have voted. And I'll be really honest, I'm very excited to see how many of you guys are answering that parents, families, and students are involved in the process. It doesn't surprise me that 100% said school nurses, but from some of the reports we've heard from families that they don't always think they're involved. So I'm really excited to see that, as well as then engaging the healthcare providers and the teachers. So that's really very interesting and very exciting for me to see personally. So, so the next question then is, in your opinion, who should be involved? And we may see some differences. This may not be vary all that much compared to the answers you guys had previously given. But a lot of times we do see a difference in who is involved and who really should be involved. So if you guys could take a moment to answer those. And again, these are mark all that apply, so you can choose all of them if you want, or decide to. Okay, looks like we have the majority have voted. I'm really excited to see some of those numbers for those others that hadn't been involved previously that you guys feel should be involved. So I think we are. I think we're all getting fairly on the same page here, and that's a really exciting thing for me. So as I've mentioned in some of the work we've done, we have heard other reports, and so it's really exciting to see you guys answer these ways. So. So essentially, the who needs an IHP? One of the questions we do get a lot, and for those of you that maybe are not familiar with IHPs, is who needs one of these and why? It's really pretty simple. Again, it's really any student that has a medical or health-related need that will occur or that could occur throughout the school day. Technically, those students should have an IHP. Most commonly, a lot of times you see it those students that are taking medications or those that need monitoring of their disability or diagnosis. A lot of times you see them with students that maybe are using special equipment or require frequent procedures. And we'll talk about, later we'll talk about a survey that we did here in Kansas, and some of the school nurses in Kansas that reported their most common health needs that they have to address throughout the day. And the needs really do vary for each student, and so that's why the plan is called an individualized health plan, so that it can be individualized based on the student needs. But so essentially anybody that needs to address their health or their medical needs throughout the day should have an IHP, so that way it's all those needs are addressed. Some of the benefits of an IHP are really, a lot of these that are listed here on your screen are related to student performance and are greatly affected by the student's health. So maybe having an IHP is not the reason why they have better attendance or improved alertness or increased physical stamina. However, having that plan and having their health needs addressed during the day, their health is likely going to be better and the student's performance can be improved. So it's not necessarily a if this, then that kind of situation, but so for some of those student performance things, having that IHP really can benefit. But those items that are specifically related to their ability to participate or their actual medical status are also really affected by the student's health. But by having this IHP and, again, having those needs taken care of or having their diagnosis or disability on maintenance or their needs being addressed and prevention of poor health and medical emergencies, these things can really impact the student's ability to participate throughout the school day, as well as their ability to even attend school. And all the ones listed here on the screen are really benefits to the student more than they are to anything else, but there are also benefits to the school and the teachers and all the staff within the school as well as all the students and the students that needs the IHP, their peers. By addressing the health needs and having an action plan in place in the event of a medical event or emergency, that individual student can really be kept safe during that time, as well as their classmates being aware of what the situation is and what they can do. Those kinds of things could also be involved in the IHP. And then additionally, IHPs can serve not only to promote good health, but also, and maybe most importantly to school administrators, it allows the school staff to be prepared in case of an emergency, which does reduce their liability and potential injury of the student or staff. And so an IHP really has benefits all across the board. And then additionally, families benefit from having their child having an IHP because then they feel more comfortable with their students' needs being met throughout the day. As we began talking about addressing health in school, here in Kansas within the grant that I worked with, we actually started by trying to integrate health needs into the individualized education plan. And we learned that not only was that really not very realistic, it was highly unlikely, but was really not the best place for health to be involved. Now, it is possible if the student doesn't have additional health needs and require an IHP, or need an IHP, health needs could obviously be addressed within an education plan to ensure that those needs are being met. But when we were talking about those with some significant health needs or for those that really might have situations or conditions that might impact their ability to perform in school, we realized that an IHP actually is the better place. And actually when we learned about it first, the staff on our grant project, we were kind of floored that we hadn't even heard of an IHP before in all the work we had done and all the research we had been doing. But regardless, we shifted gears. We began looking at how we can support nurses and students and families in this IHP process, in the development and implementation of an IHP. And we started out actually by just gaining some information and interviewing school nurses across the state of Kansas. And these interviews really led us to the conclusion that there really was not a standard process. Oftentimes there wasn't any guidance from the school, either the school district, the state level, co-op level, or even the local school. But then we also found additionally that many of the school nurses shared that they held the sole responsibility of creating and implementing an IHP. And that was kind of alarming to us, that families were not involved, that although it might be their responsibility to ensure that it's developed and implemented, those nurses were also sharing with us that they were pretty much the only person that did that they didn't have anybody else that supported them, which is why I was very excited to see some of the responses you guys gave previously. So after hearing from those nurses and conducting these individual interviews with the nurses, we really decided something needed to be done. And that here in Kansas, the reports we were getting from our families and even some of our medical providers kind of alarmed us, and we decided, okay, it's time to do something and make sure that the students' health in our state are being addressed. And so what came next was we really started looking at how do we do this. And so we got a team together that consisted of representatives from a family advocate organization here to have the family voice there. We had school nurse participate on the team. We had a healthcare provider organization, special education was there, and then our staff here at the health department. And we determined that we really needed to do a little bit more to find out what was actually occurring and what processes were in place. And so we decided to conduct a survey of all the school nurses in our state. And from that, we then decided, well, maybe there's an option to quote-unquote standardize or create some kind of template or a form that could help the nurses as they begin doing this. And so we then also decided that within our grant, we were in the process of creating a model, a multidisciplinary model of looking at healthcare transition and focusing on putting the youth in the driver's seat of their health. And we wanted to incorporate that into what we were doing with the youth, but we also understood that IHP was something that all students, didn't matter what age they were, all students needed something like this. So we had our first team meeting. From that team meeting, we decided let's do the survey first. And so we conducted that survey in 2012, earlier this year in May. And we had 13 questions on this survey. And some of those were a combination of simple yes and no. Some were multiple choice. And a lot were actually quite open-ended. And the initial goal of this was to identify, again, those processes that the school nurses were going through when it came to creating an IHP, what protocols or policies might be involved. And then as well, we wanted to find out what the school nurses really felt were critical to ensure that we had in any activity or any potentially standard form or anything we did later, what those specific critical components were. And so we'll go through, I want to share a little bit of our survey results. And one of the very first question we actually asked was, how many schools, as a school nurse, are you responsible for serving students in? And we were I knew we had a problem in Kansas with our school nurses because unfortunately, every time there's a budget cut, we see that that's one of the positions within the school that gets cut. And that's really unfortunate, but I was unaware that with some of our larger co-ops and in our rural communities, that there's really only one school nurse for up to 8 schools. And so we found that through this survey, there were actually some school nurses out there that were assigned to as many as 8 different schools that they were supposed to provide care for, create plans for, make sure that all the students' needs were taken care of. But yet, even within 1 week, there was no way for that school nurse to be at any one of those schools for an entire day. And so we kind of saw that being potentially a problem, that they weren't going to be there in case of an emergency. And so that was one of the things we found through the survey. And the other thing we asked them was, what was the total student population in the schools that you were responsible for. And as you can see, the majority mentioned that they were assigned to either, they had been assigned either 300 to 600 students, but there were some that were even as many as over 2,000. And that's an awful lot of students to be responsible for developing these IHPs. Now, of course, not every student in the school is going to require an IHP, but if you look at the national statistics, 36.1 of all school-age children, so from 6 to 17, were, based on the National Survey for Special Healthcare Needs 2009-2010 survey, 36.1 of those school-age children have special needs. So if you look at that over 2,000, you could be looking at well over 700 students that potentially could need an IHP. Now, again, it's not likely that all of them would need that even with that number, but it would show potentially how difficult it could be for school nurses to be able to develop and implement all of the IHPs that might be needed in their school. So the prevalence of having the potential of needing an IHP is quite high in some of these districts or co-ops, and the school nurses, I can understand how it would be difficult for them to be able to engage an entire team and really do everything that they needed to do, and to where the families and everybody else involved felt comfortable with it. So it kind of sheds some light onto some of the issues that we have here in Kansas with our school nurses, and I would venture to guess that some other states have similar kind of statistics there. So the next question showed the percentage of students within the schools that required medication throughout the day. And all of these students that need medication, that are administered medication throughout the day, should have an IHP. And that IHP should really address things like medication dosage, possible side effects, what happens if there's an accidental overdose or a missed dose or something to that effect, as well as then making sure that there's a process in place for any time that medication changes that the school nurse is informed about it. And so you can see there's most everybody responded that about less than 25% of their students were taking medication. But again, all of those students would require some form of an individualized health plan. The next question we asked was approximately what percentage of students have some type of health plan on file within the school? And we did see that the numbers went up a little bit in some of the other percentage categories. But again, it was higher within the less than 25%, and which is very, it's kind of a very subjective number in this question, but it kind of gave us an idea that there are some schools that have higher needs even if they are students that aren't on medication. And although a common comment that we received when we did our interviews with the school nurses indicated that of the students that required IHPs, many of them had needs that can only be addressed by a school nurse or a registered nurse or even a licensed practice nurse. But when we asked the question in the school nurse survey, the slide actually contradicts that a little bit, and showing that most of the nurses, of the nurses that responded, really very few indicated that over 75% of their students with needs required only their care. And the clear majority is showing that the implementation components of an IHP could be possibly delegated to other people, reducing that pressure and the stress from the school nurse. So they could create the plan, but then potentially delegate that, some of those needs and some of the implementation of that to other school staff or the teachers that are working, or even potentially the student aides that are working with those students. Our sixth question was really open-ended, so there's not a graph that goes with it, but it was really, the goal was to capture what services the school nurse indicated that the things that only they could do. And the items that are listed on the slide were the most common responses. However, we also received others that included things like suctioning, vision and hearing screening, blood pressure checks, tracheotomy care, and family education. And I'm sure the list could continue to go on and on and on. But there were also several people in the survey that indicated that there were no services that only they could provide. And one person even went to say that there's nothing I can't, or there's nothing that I have to be able to do. In fact, I am told I have to delegate every single thing to somebody else. And so, and many of them indicated that there were certain things that they they took responsibility for, but then there were things that they delegated out. So it did show that there was a very distinct difference depending on obviously the needs of the student, but also what the schools were comfortable letting other staff in the school do. Because again, we found that there was no specific protocol or process or anything that specifically said the school nurse must do this. But some of that was even the personal preference of the school nurse and what they were comfortable giving on letting somebody else do. The seventh question we had was, do you have a protocol for developing this student health plan or the individualized health care plan? And we actually found we were pleasantly surprised to see that many of them did have a protocol, but we also, looking at the number of those that said, no, I don't have a protocol, that number is still slightly alarming. Because that means then there's nothing set in stone that says these are the type of children that need one. There's nothing that says this is what steps you need to do. This is what information needs to go in there. So not having that protocol could potentially put some of those children at risk. And then we also asked, after that question as a follow-up, we asked what the process or protocol was. And the responses really, really varied. Some of them went into who was part of the development process. Some of them went through, okay, well, I developed it, but then I train others to take over the responsibilities. And then there were others that said, I developed it, and I'd like to train others, but there's nobody else for me to train. But those responses really, really varied. And it also varied. They mentioned things like the plan is located in the school nurse's office, and it's locked in a file cabinet. Well, in that instance, what happens if that nurse is sick that day and there's not a replacement nurse to come in? What happens if that's one of the nurses that are traveling across a, probably 100 miles worth of area to 8 different schools? And so it was one of those. And then there were others that talked about the plan was located in the office so that any teacher or anybody could go get to it. But they even indicated it's located in the office for the teachers to access, but I don't believe that the teachers know it's there. And so there were some of those kind of comments as well. And then we had some that did indicate they had district guidelines that they followed, and that's what they did. So the answers were varied in how they did it and what they told us and what information they shared. So it's kind of difficult to figure out what that was, but we did identify that not everybody has that same process and not everybody uses the same, even if they answered that they have a protocol in place. That protocol is different for various schools and various districts, and most likely across different state lines as well. The next question we asked them was, do you use a standard form or some kind of template? And our research really in Kansas found that even though many of them indicated they used a standard form, that standard form was probably, we identified, was probably the standard for just that school nurse. That it was something that they likely created as a template for themselves, because we couldn't find in any of our research where there was a standard form. There were certain ones that were specific to, for example, asthma or diabetes or seizures, but they weren't standard that it could be utilized for any student. It was only specific for that one condition. And so we also had then reports from nurses indicating that they would really love some form or template to follow to help them, because it is difficult to remember all the different pieces, and it can sometimes be overwhelming when you have so many to create, and especially if those have high needs. There were also some that indicated there's a software program out there that they utilize, and the ones that mentioned that they used those programs said that they really liked them. However, it's computer software. Not every school had access to it. A lot of schools may not be able to purchase that because of funding constraints, and so that even though there might be a computer software program out there, many people, it didn't sound like, were utilizing it. And then again, we were pleasantly surprised when we did our survey as well. Many of them responded similar to how you guys did in our polls earlier, with that there were a lot of people that indicated parents and families were involved and physicians and healthcare providers were involved. But I think one thing that I find that we really wanted to talk a little bit more about as we move through the process was, well, what about the teachers? Those teachers are the ones that are with the students on a daily basis and pretty much there throughout the entire day, but yet they were not either being involved in the process or they weren't even being informed about the process and the fact that there was a plan there. So the level of engagement or involvement, although they mention that these people are all involved, with the survey we weren't able to identify what that level of engagement or involvement would look like. And we identified and anticipate that that looks very different across the state and depending on what the child's needs are and those kinds of things. But again, the fact that they were saying they were trying and that they did engage parents, families, and physicians was really a very positive thing that we found. We also then asked, and I don't know if it's going to be difficult to see on the screen. It looks like it's all coming through pretty clearly, but we also asked them to rate these different components of a healthcare plan and the different things that might be needed within a healthcare plan, and we wanted them to tell us what's critical. Oh, sorry about that. What's critical for those students, and for that plan, what's maybe supplemental for that plan, and then what's completely not even necessary at all. And you can see there were a lot of things that many of them didn't talk about it not being not necessary, but although those were generally more supplemental than critical. But we also then had an open-ended question, and so that column there that says all other responses, they had an option to write in anything else that they wanted. And we took all of those responses as well as the survey responses we got here and used that in the next phase of our initiative here in Kansas. But this was really helpful in identifying, okay, if we were going to try to create something that they could utilize that could assist them in their work, what would the things that we needed to ensure were in there and making sure that they were there in front and center. So this was a really helpful response that they gave us. And so one thing I would like to ask everybody there, or everybody here on the webinar, was if you develop these IHPs, does your institution, your school, if you're with the health, government agency, either with the state education, state health department, or another one, do you guys have a standard process in place that you can share with school staff and families to really help them with development of an IHP? So we have another poll here, and I think Melanie's going to launch that here in a moment.
Heather, this is the only question that I can seem to pull up right now. I hope this is the correct one in terms of using a standardized form.
Yes. Well,
okay.
It might be. I think that might be the next question, but that's okay. I might have changed my language a little bit and when I put it on the slide, so I apologize for that. So we'll go ahead and use this question then. If you develop an IHP, do you use some kind of standardized form or template or that software program to be able to help you do that? And we'll give just a few more seconds and let everybody participate. But again, we know many of you indicated you don't develop IHP, so we can go ahead and close that one, I think. And it looks as if everybody indicated, anybody that does develop IHPs on the webinar here, that none of you guys have a standard template or form. And so I hope that the information I'll share here next will be really interesting or potentially valuable or useful for you guys. But again, as we began looking at this, the number one question was, how do you plan or how do you standardize something that is supposed to be individualized? And as we developed our plans and what we wanted to do and what we thought might be beneficial to school nurses and students and families and everybody involved, we really thought about that a lot, and we realized that it's not possible to really standardize an individualized process. However, what we could do is create a template or a form that offered both options. And so what we did was we came up with a core form, as we call it. It's just a standard 2 pages front and back with really the critical information that was identified by the nurses that every IHP, according to them, should have in it. And then, so that was kind of the standard part of it. So it gave an opportunity for a form that then could be quickly filled out. It's just a front and back page of the, things like like the child's diagnosis, contact information, emergency contacts, parent contact, all of that kind of stuff that every IHP likely would have. And then we created these 5 supplement forms, and we call them supplements, which kind of allows for the individualization and allows the school nurse or the person developing the plan to look at each individual student's needs without creating an entire plan that was very, very long and lengthy. Because we actually started and took all of the information that the nurses gave us of what was required, or what was critical and what was supplemental, and we put that into one big long form, and it ended up being like 10 pages. And we knew that was overkill, and it was overwhelming, and it likely was going to be difficult for anybody to really keep up with. So we created these additional forms. And again, I hope this is easy to see on your screen. I tried to get both pages on the same slide so you could see what it looked like. So these are images of what that form looks like, and it's, again, the core form, and it gives the information that is needed for most everybody that would need an IHP. Just the general, who do they need to talk to about different things? What are the diagnoses? What are, on the back side, there's a thing there, or a box there for potential problems. Here's what the trigger might be. Here's what you need to look for to see that there's something occurring. Here's what an intervention, if we have something occurring, here's the intervention you need to do and what treatment we have available for that. And then it offers an opportunity for each team member to be able to be involved and to sign off and say, yes, okay, I reviewed this, or I've provided the information that I can provide. So again, this is the core piece of it. And then we moved to the supplements, and the crisis supplement plan, really, this form, or the crisis plan supplement, sorry, this form is really to help create that plan in case of a medical event, a crisis, or some kind of an emergency. So it's, again, an if this, do this, kind of a similar focus as the problems and the trigger and that kind of stuff that we had on the core form, but this allows it to go a little bit more in depth. And as you can see, it's still very general. It's just basically, here's things to think about, and then what to do in an emergency situation. And so it allows the opportunity for those different emergency situations to be identified based on the student's needs and the student's health history as well, because we have had cases where we've had families tell us, for example, a child with seizures. Well, if that child has a seizure disorder, and if they have a 10-second seizure, that's really a very small, minimal concern in their book. It's when they have those minute-long seizures, that's when they really need to get somebody in there and get 911 there. And we have had families tell us, with my child's seizure activity, he's used to having these little 10, 15, even 30-second seizures, and he knows what to do when he feels that coming on. He sits down in the fetal position, and he just stays there until it's over because he knows what that looks like for him. But then when like this particular mom shared with me that they had a substitute teacher in that day, she didn't know what to do because the individualized health plan was locked in the nurse's office, and she called 911. They rushed the child to the hospital. Well, the child was now traumatized from having to be in an ambulance. The medical cost for that, of course, falls onto the family, and so that's as many of you probably are aware, ambulance rides are not cheap. And so there was all these additional things that came after the fact because simply there could have been a plan in place where the substitute teacher could know about it. Of course, the family shared this is not necessarily an everyday occurrence, but it does happen. And so having these plans can really be beneficial for everybody that works with the student. The medication supplement form is simply that, a form to capture all the information about the child's medication, when they need to take it, how do they administer it, when it started, all of those kinds of things. And it allows opportunities to put in their medications that even though they may not be administered during the school day, they could have an impact on the student's ability to participate in class or to focus or concentration or any of those kinds of things. So it gives an opportunity to not just talk about what medication is being administered, but what does the student have in looking at the whole picture. This form is something that a lot of the nurses actually indicated that they didn't feel was extremely necessary. However, we had a lot of parents when we talked with them and did this within our Family Advisory Council and asked for their feedback. They shared that because of the hospital admissions, their child was missing a lot of school because they were hospitalized frequently. And that really does impact not only student performance, but those attendance records. And so the families felt very strongly about making sure that the school staff know what that record looks like and that there's a potential for these hospitalizations so that they know what to do when a student maybe hasn't been there for 3 days and somehow the note didn't get to the teacher. They don't, call the education department saying that this child's been a no-show and all of these other things occur. And so that was a form that we left in there because our families really felt that that was important as well. And then when it comes to the medical equipment or potentially assistive devices or equipment that the student might need, training is typically needed by the staff who work with the student. And we, after talking with some of the nurses and different individuals, we found that a lot of times that level of information, although the teachers and the school staff know that the student would utilize that medical equipment, nobody really knew but the nurse or potentially one other person in the building how it worked, what they needed to do. So what happened if that person wasn't there one day? I had a family that also shared with us that their child was actually sent home one day. The parent was called and said, the nurse that knows how to do the tube feedings for your child isn't here today, so we're going to need you to come get them. So the student had to miss out on school because there wasn't effective staff training. And so you can see why that could be potentially very important as well. And then as we started this project really being a transition-focused project, but we realized very quickly that health is important and for all students at all ages in all aspects of life and not just within transition. We did leave a transition action plan in here, but we left it broad enough and general enough that it actually can be used for any kind of transition. So this could even be for somebody, for a student potentially with some behavioral issues or for potentially students with autism that have a very structured environment when there's a change that's going to take place, which is for them a transition. So this can be anything from, changing teachers, changing grades, moving to a new school, or even that more traditional school definition of transition is becoming more independent and managing their own health and education goals. And so this transition action plan can really be used for a variety of things. So that was kind of how we addressed this issue of, okay, what can we do? How can we support our nurses to give them an opportunity to be more or to have some tools and available to them, but also with keeping it as an individualized process. So one question we would have for anybody, and this is part of the discussion piece of it, that we would have for anybody here on the webinar is if you have any ideas or comments or concerns or anything about some of the key components we either included in the stuff we've done or are things that maybe we are missing. So I don't know, Shona, are we able to unmute everybody so we could have some potential discussions here?
Absolutely, I believe.
Oh, and I just saw you chatted. You said something.
Yeah, no, it's okay. I believe I can either unmute individuals as they have questions if they want to raise their hand. They can submit questions, written questions, and I can read them out loud. It's really up to however folks want to do this. So Leslie Huber has a question, so I'm going to unmute her, and hopefully we'll be able to hear her.
Wonderful.
Leslie?
I'm from Iowa, and I have a child that has special health care needs myself, and I was always told by the school that the medical medical things are separate from the education record, so I was wondering about HIPAA and FERPA compliance and what forms you're using with that.
We have not actually implemented. That's part of the next steps of what we'll talk about here in a little bit. So we will be addressing HIPAA and what that would look like within each school. What I have learned is that actually will, although one would think it would be very standard across the board, but every school that I have experienced has handled that slightly differently. And from what I've heard from families, they have indicated that they haven't had to necessarily sign any kind of release to the school unless they were having the school send things to, for example, a community provider or a medical provider. and those forms looked very similar, I think, to some of the things you would find in a doctor's office with asking for medical record information. So I will say we haven't done a whole lot of work on that at this point. We're still in the process of that, and that is something I think we will be addressing as we talk more about our future initiatives with this. The grant that I worked on really primarily looked at what tools can we create, and what we're doing with Heartland is then looking at how do we utilize those and doing some testing and implementation and things like that. So we'll talk more about that in a little bit, but we'll make sure, and HIPAA is something that we have discussed, but it's something that we will make sure is addressed very, very in detail as we move forward.
Great, thank you.
So our next question is.
Oh.
Hi, is that me then?
Yes.
Okay, my name is Nina Baker and I'm in Nebraska. One of the things we have to have in the IHP, I've got an echo so I hear myself. One of the things we have to have is doctor's orders for the cares being provided. And I don't see anything on the form that would address prescriptions or doctor's orders.
Okay. Definitely something we will look into and see about adding. Do you, in your experiences and with the work you do you think that would be something that's best utilized, maybe, for example, on that core form, or would that be a separate supplement all in itself?
I don't know, because the nurses develop their own IHP. We have no form. We have suggested things that need to be in it, components, but one of the components are the orders.
Okay. Well, we will definitely, as a team, we'll sit down and look at that and see where we might be able to add that, where we will be adding that, and talking as we move forward with implementation and testing of all of the tools, we'll keep that in mind and make sure that we get that in the right spot. Thank you, Nina.
Anybody else have any questions at this point or comments? I don't.
Okay. Well, there will be many opportunities to share your thoughts and ideas throughout the webinar. So the next question is somewhat related, and I think you know, Nina and Leslie both kind of addressed this about potentially some challenges that might arise. You know, for example, the HIPAA thing could be a challenge that we have to look into and overcome as we move forward with implementation of this. But do you see any, specifically when we're talking about utilizing a standard template or having something that the school nurses can utilize, with still being able to add new things, add whatever else is necessary, bring their own information and their own ideas, but is there anybody on the webinar that really sees any challenges with having a standard, quote-unquote standard process or template?
Nina again.
Nina?
Did we lose Nina? I think we may have lost a connection with Nina. She's unmuted.
Well, Nina, if you...
Yeah, I muted myself, sorry.
Oh, there you are.
Trying to deal with that echo. What I've seen is with standard templates is that nurses or others may just fill in the blanks and not think beyond that. It's kind of like pull out the form, fill it in, and there may be other things that a child needs that gets overlooked. I teach that when the nurses in our state use things like the autism form, or not autism, the asthma form, or something like that, that the parents be sure to put in the very individualized things their child has, because our basic asthma forms are kind of general for anybody in the school that might develop asthma today.
Okay.
And might not have specifics in it.
So maybe that would be a good addition as potentially maybe even another supplement form that we put as a highly recommended form that it be a form that we ask the family to fill out after they've reviewed it. And that way it can be something that it's, you know, anything other than what's already in the standard one that needs to be addressed. So that's a very good point. Thanks, Nina.
Well, when I teach IHP, I tell parents sit with the nurse and develop it.
Mm-hmm.
So hopefully parents aren't
Hopefully they
getting
can do
something
that.
developed by somebody that they have to review and then try to make suggestions on changing.
Okay. And that would, of course, be ideal for them to sit down together to do it. Absolutely.
Thank you.
Thank you so much, Nina. Are there any other comments, questions?
Leslie has another question or
Okay,
comment.
wonderful.
I'm wondering how frequently the forms get reviewed with the standard process. So do they have, you know, if they get hospitalized, then they have to re-review it, or is there any sort of template for that, or is it a school year normally?
From my experience from talking with nurses, they generally review them annually unless something changes. But in all honesty, some of those changes don't get always addressed with the school nurse. I've had families also share with me that, well, they didn't think about after my child was hospitalized, and when we asked them, well, did they know your child was hospitalized? Well, I don't know. And so it's one of those too, that it's that communication and that open communication between families and the school to ensure that those changes are being made when it's appropriate. We have you're touching on all of our exciting information that we're doing in our new initiative, but that will also be something that we'll be addressing. And what does this what is a process, or what's standard as far as how often do you do it, how frequently? You know, maybe it's something that it's created and then just annually reviewed. But I anticipate that it needs to be reviewed much more frequently than annually. But that's what we'll be doing with our future and our next steps as well, is creating that standard process. So it sounds to me like you might need to be on our team. So we'll get to more of those details here in just a moment. I'm about done with my part, and I'm going to hand it over to Melanie to share all the really good stuff. Do we have any other questions or comments at this point?
Susan Anderson in Missouri asked if the doctor's orders could be addressed with a signature from the doctor on the medication supplement or the crisis plan supplement. I think it's a broad question.
Yeah, I think those are definitely good suggestions, and as we move forward with identifying what there could be and what needs to be in each of the states. Because again, you know, and this is something that this was just a general, is this something that could help nurses? And that was what our initial goal was. And as we move forward with that, we identified that there might be a greater need that we can start working towards. And so one of the things that's definitely good suggestions as far as can we do that, and will that be enough for each of with the schools? Will that be enough for the doctors? Will that be enough for the parents? All of those people involved. And so, so I think those are definitely questions to ask as we move forward. Okay. Shona, do we have any others at this point?
Nothing right now. So I can mute myself again, and you guys can keep going.
Okay. All right. Well, the next part is actually, did I skip? I might have skipped too many. Hold on. Let me go back one. Nope, I didn't. Okay. Well, the next part is actually all of Melanie's stuff, and she's going to share with you a little bit more about where we're headed and what you guys need to know about that. So, Melanie, it's all yours. Oh, I have to share. I have to give you the keyboard thing. Control. I have to give you control. There you are.
Oh, perfect. Okay. Yeah, so this is Melanie. What I would like to do is provide an overview of the Heartland Genetics Collaborative, including our plans for the IHP project. So the Heartland Genetics Collaborative, we're a collaborative network of organizations and individuals who have an interest in clinical genetics and newborn screening services. And I'll talk a little more about who our partners are in further slides. What is referred to as the Heartland region Sorry, I have a delay, or maybe I lost control here. Heather, I can't seem to advance my slides. Would you mind just controlling them for me if you can? Great, thank you. Let's see if I can. Heather, I can't seem to, I'm sorry, I'm having technical difficulties there. That's perfect. So on this slide, what is referred to as the Heartland region is comprised of 8 states. We advertise today's webinar to the entire region, and it's my understanding that we have participants joining us from most of the states. So I'm very excited that we're reaching such a wide audience. Please, next slide. So a little bit about the history of Heartland. In 2004, the federal government awarded grants to establish 7 genetic regional collaborative groups across the United States, and then 1 national coordinating center to oversee the regions. And the goal was to have each region attempt to improve access to genetics resources and services within their particular region. So we continue to be funded by HRSA on a 5-year funding cycle. This year we are starting our 3rd cycle. So the projects we're starting right now, including the IHP project, are to span into 2017. Next slide. So currently the Heartland staff consists of 6 individuals. We have 2 project co-directors, Dr. Bradley Schaefer at the University of Arkansas for Medical Sciences, and Dr. Klaus Viranga from the University of Oklahoma Health Services Center, or Health Sciences Center. And then a lot of our work is done by Lori Williamson-Dean, who's our project manager, and then Shona Whitehead, our assistant project manager, who's joining us on today's webinar. Our administrative assistant is Dustin Foster, and then there's myself, the project coordinator. So regarding current partners, in each of our states, our current partners include state agencies, especially the state genetic coordinators and the newborn screening coordinators. I really have to give a shout out to these individuals because they are our key contacts for the states, and they are involved in the vast majority of our projects. Our partners also include healthcare providers, including medical geneticists, genetic counselors, and primary care providers. And then importantly, we also include advocates, family members, and other organizations. So our mission is to ensure the best possible outcome for individuals with genetic conditions. Overarching goals are to improve the understanding and awareness of genetics, expand access to health care for individuals with genetic conditions, and to translate new findings to improve the quality of care within the Heartland region. So similar to taking sort of research from the bench side to the bedside and making sure that we're translating any new findings into improving care. So to give a sense of how we do the work that we do, the Heartland is structured into work groups. Each Heartland work group consists of a Heartland staff facilitator, a specific number of core members, and then other members representing all 8 of the Heartland states. So our primary work groups include the newborn screening work group, the clinical services work group, and our advocacy work group. And then we also have ad hoc work groups that come and go when we specifically need them for certain detection and implementation, medical home, and transition. And so these work groups meet every 4 to 6 weeks, usually by teleconference, and we have at least one face-to-face meeting every year at the annual Heartland Collaborative meeting. Each work group has its own projects to work on throughout the year, and most work is conducted by phone or email. And I just want to say that while the majority of our collaborators and work group members are clinical genetic service providers and state health program representatives, we collaborate with a broad range of stakeholders. So really anyone who's interested in the Heartland's mission can get involved. And truly, you know, the more different perspectives that are brought in on projects, I think the better the work. So over the next 5 years, the Heartland work groups have several projects planned. So I just want to give a little brief summary of some of the stuff that we have in the works. We'll be working on a clinical management project aimed at increasing access to tools and resources that primary care providers can use when caring for patients with genetic conditions. You know, many of these genetic conditions are rare and something that primary care providers don't see very often. We'll be working to enhance and support the Heartland's early hearing detection and intervention program. We'll be working to develop a newborn screening implementation toolkit for the Heartland states to use when they're adding new conditions to the state panel to hopefully facilitate and expedite that process. We'll be working on telemedicine enhancements, aiming to increase the use of telemedicine services for genetics. And this is really important within the Heartland region because so much of our area is a rural population. And so a lot of our patients do not have the means necessary to make it into metropolitan areas to get access to genetic services. We'll have a transition project aiming to improve the process of transitioning children with genetic conditions into adult care. And then last but certainly not least, we have the IHP project, through which will hopefully improve collaborative care and family-centered care for children in the school setting with genetic conditions. So the ideas for almost all of our projects don't actually come from the Heartland staff. They come from the members of our work groups because they're the ones out in the states working in the trenches and really caring for individuals with genetic conditions. So they know what would be really helpful for them. And the Heartland became interested in IHP efforts because of our advocate work group. So this group consists of family advocates from each of the states, and they recognized that some families and organizations were not aware that IHPs existed. Advocates that knew about IHPs voiced issues with how they were being developed for their children, reporting ineffective procedures or little to no process. And advocates felt that some of the school systems had poor rates of IHP implementation. So this is actually kind of consistent with some of the survey findings that Heather reported earlier from Kansas, that there seems to be no standard process in place and families don't feel like they're as involved as they should be. So our current plans regarding IHP, so the Heartland knew of the work being done in Kansas by Heather and saw this as a perfect opportunity to build upon the activities that are already being done. So currently we're working to identify and engage key stakeholders from other Heartland states outside of Kansas to get further involved in IHP efforts. And we're thinking that these people should include genetics nurses and school nurses definitely, family advocate organizations, state school health consultants, primary care providers, and really anyone else who has an invested interest either in IHP development or specifically the population of youth with special health care and genetic conditions. So to keep the discussion going, you know, we know what Kansas has been doing regarding IHPs, so we'd really like to learn from other states who are here today what they're doing. Is anyone aware of IHP initiatives or projects occurring in your state at this time? So Shona, if maybe you can let me know if anyone raises their hand or has questions submitted.
I will absolutely do that.
Thank you. Or also, if you don't know of anything going on in your state and you're wishing there was something, just let us know that as well. It'd be helpful to know if we don't know of anything going on.
Marjorie?
Hi, this is Marge Cole from Missouri. I think we'll notice that there's a need for us to develop individualized healthcare plans using a standardized nursing language. And many of us in all of these states are thinking about NIC, NOC, and NANDA and how to incorporate that language into our IHPs so that they are measurable.
I'm sorry, Marjorie. I don't know if anyone else has the same discussion.
Marjorie, I'm going to mute you while Melanie answers. But if your question wasn't clear because of some of the feedback, if you want to type it, I'll be happy to read it out loud. While we're figuring that out, Annie Consbrook submitted a question. Because people are, because it's likely that school psychologists are more often in the classroom, that they have been involved with creating plans for students and related to behavior. How are people involving psychologists and nurses on the same page for IHP? It seems like sometimes they're often working against each other.
This is Heather. That's a very, very good point, and that it's something that we definitely need to make sure that as we move forward with our IHP initiatives, that the school psychologists are being involved or are involved in what we're doing, so we can engage not only them but also to work with them to find out how can we do a better job of collaborating with them. So that's a very, very good point, and I think that's something we can address as we move forward, to try to engage them in our project so that we can get on the same page and stop working against each other. So thank you for that comment. And Marjorie, I didn't hear a lot of yours either because of the feedback, but I did catch, a couple of things as far as that you felt there is a need for some kind of standard process or some kind of guidance for individuals. I think that's what I caught. And I know Shona said you might be able to, I think, submit it through the question feature since we're getting the feedback from your line. And so I think as far as that goes, I think that that's essentially what we're looking at, is what is needed within the different states. And as we move forward, we'll want to hear from all of the states as well on how you feel about that. And is that something that would be beneficial in your state? And if so, how can we make sure we do that? Because we also know as we move forward, the activities in each state could potentially look different because every state is structured a little bit differently, and every state has a different setup as to how education and school nurses work and what training is already in place and what guidelines are already there. And so we'll want to take all of those different things into account.
So Marjorie submitted her official question by writing. Do you think there is a need for school nurses to use a standardized language in developing IHPs, NIC, NOC, NA, NDA, and measuring outcomes from IHPs? We all need help using NIC, NOC, and NA, NDA. This will standardize our plans. I apologize for not knowing what those abbreviations are.
And I can't say that I do either, Marjorie, but I think you're absolutely right. I think there is a need for not only there being some kind of tool out there to help, and maybe the standard form is really just a tool that could be utilized, but I think your point in using standardized language so that everybody is on the same page across the board is actually very, I think that's an underlying thing, and that from what I've heard from families as well as some of the other professionals I've worked with, I think you're absolutely dead on there. And I will do some research to find out what those acronyms mean as well, because I'm not familiar with them. But I think you're onto something there for sure.
Okay, excellent. Well, let me. My next slide is specifically addressing what some of our next steps are from the Heartland's perspective. So our immediate future plans for the IHP project, meaning within the next year, will include hosting a learning collaborative. So what do we mean by that? A learning collaborative is an ongoing learning process that brings together people or teams of people to work on improving a process, a practice, or a system while learning from their collective experiences and challenges. So for the IHP project, this would entail bringing together key stakeholders from across all of the 8 states who have an invested interest in IHP and the population of children with genetic conditions. And what we do is we start with the IHP forms that Heather has created, but we haven't taken that next step into implementation yet. So what we'd ask for members to do is to test them in the real world, take the forms out, have families fill them out for their children, have school nurses try to implement them in their daily work, see what works, see what doesn't work, come back to the Learning Collaborative through a series of meetings to provide feedback, suggest changes, retest the form until the materials and the process of using the materials seem most effective. So that's what our next steps are within the next year. And so to ask another discussion question, let me see if I can advance my slide. There we go. Oh, thank you. So we think that school nurses obviously are an important group to involve in the IHP project. So if anyone happens to know specifically who regulates or trains school nurses in your state, feel free to either type it in and submit it to Shona for her to let us know, or raise your hand to let us know if you happen to know about the regulation and training of school nurses.
Is anybody familiar with this in your state? Okay.
Deborah in Iowa has indicated that the Iowa lead has recently retired, so she has to follow up and find out who the new person is.
Okay. Well, and Deborah, if you are able to find that out and want to share that with us, that would be really, really great.
Yeah, we'll be providing our contact information at the end of the webinar, so definitely if these are questions that you're not aware of or don't have the answers to, but can find out, just shoot us an email and let us know what you learn.
And Annie from Nebraska says that the Department of Health and Human Services regulates, but she's not sure about training. And in Missouri, they have a school nurse consultant through the Department of Health and Senior Services that helps train them.
Okay. That's how it is here in Kansas as well with the training. We don't really have a regulation that I'm aware of. Okay.
And just to interrupt briefly, Deborah is asking about archiving and handouts, and yes, we are working on that, and we'll hope to have it available as soon as we can.
Okay.
All right, so we can go to the next discussion question, and this may be something that you all could potentially contact us with by email after the webinar, but we're wondering who in each state we should potentially contact to inquire about IHP processes or protocols. So that may very well be some of the individuals that we just learned about from some of the states. But if anyone else has a quick comment about that, feel free to raise your hand or submit by question. I think what I can do, while people are maybe thinking about that, I can go to the next slide. I have one more slide regarding future plans, future beyond the next year. Once we have what we believe to be an effective IHP materials and processes as a result of the Learning Collaborative, our long-term plans will shift to implementation. So first in schools to ensure that it will fit into existing IHP protocols, then to larger scale implementation in the state and project evaluation to see if we're making a meaningful impact. And it's going to be during this process as well and through the Learning Collaborative that we start to troubleshoot some of the issues, specifically like what Leslie brought up earlier about HIPAA compliance, those types of things. It'll be through this collaborative that we'll be able to address some of those possible issues. And if successful, by year 5, we'd like to be able to propose state-level policy changes. So that's our longer-term plan for the project. So our last discussion question we can maybe flip to one more slide. Perfect. What challenges some may anticipate that we might run into with this project in your state. Some of this may have already come up, but does anyone anticipate issues with getting the right stakeholders involved, staff training, implementation issues, things like that? If anyone has any last-minute thoughts or questions, we'd love to hear them.
It doesn't look like we have anybody raising hands, or let's see. Shona, do we have any new questions typed in about?
Susan Anderson has a question, and yes, I was going to get to it. Susan, let me
I'm sorry.
No, it's okay. I will want to read it in its entirety. It's related to newborn screening. If newborns aren't in the school system yet, who would take initiatives in developing an IHP? It seems in Missouri that the school nurses take the initiative once the student reaches the schools, but for newborns, they are not in the school system yet.
Okay. That's a very good question. My experiences with IHPs has pretty much been the only standard, or the only, I guess, protocol that I have seen is that the school nurse creates those once they're school aged, of course. I have not, other than hearing that, personal physicians, maybe the genetic providers, genetic counselors, those kinds of people, they might be the ones that would create something like this for those that are before they get into school, so the newborns and moving in that direction. That is something I will pose that question to. I don't believe we have any of our newborn screening staff here on the call, but they are next door to me. So as soon as I get off the call, I will go over there and just talk to them about that process and what they think as well. Melanie or Shona, do you have any thoughts on that? Because I think that's a very good question, and honestly, my only thought would be the primary care provider or the genetic provider.
That would be my thoughts too. The only other thing is that if there's a long-term follow-up program in that state through the health department, that they may have some responsibility between in those initial years. There are a couple other questions. So yes, we will have to follow up on the between the newborn and school age area, because I don't think the three of us have any answers.
And I think that's a really good point that you guys bring up too about that, because that's not something we have talked about. And we were talking about IHP as it relates to the school, but I think it's something for us to come back to the drawing board and talk about. And should we be talking about it not just at school age, but in all aspects, and including the newborn screening folks in what we're doing. So I really think that's a good point. Thank you for bringing that up, whoever brought that up.
So Mark, I'm going to unmute you so you can ask your question and make your comment. Mark, can you hear me, Mark? It may not work. So I'm going to read Mark. Mark had a comment. Mark Smith had a comment very early on, and he said, let's see, he hears stories. He said he answered the poll questions from the point of best practice. He also hears stories to the contrary. His question is, what are caregiver, youth, and professionals' options when there is either disagreement on the need for an IHP or disagreement on what should be included in the IHP? That's where he has heard the most concern from families and professionals. What are their options when disagreements arise? In most cases, it appears a deadlock occurs. Also, not all schools have ongoing access to a school nurse.
Okay. I will do my best here. I have not been involved in helping settle any disagreements in that respect. However, what I have heard from the family organization that I work with, and some of the things that I've heard them talk about, is that especially if the child has an individualized education plan, an IEP, which is through IDEA, so regardless of what it's called in your state, if they are to have a plan that is set up based on the IDEA laws, my understanding is if the parent requests, or that the parent and or student requests that these health needs be addressed within that plan, that the school has to comply. Now, that could be different in each state. I don't know. That's my understanding, because I have heard our family advocate organization talk a little bit about that with another family in one of our family advisory meetings. Outside of that, now that goes the same if they have a Section 504 plan from the Rehabilitation Act. If there's a 504 plan in place, those needs have to be addressed as well. Now, so whether the school includes those within one of those plans or they create an actual IHP, as long as the needs are being addressed, I think that's the biggest issue. As long as those needs that are that the student has and that the family has concerns about are being addressed. As a state person, I would like to think that the schools, if the family is requesting an individualized health care plan because they're afraid that their child's needs are not being met, as a state agency, I would like to think that every state agency would be willing to comply with that. But I also understand that that's not always the case. The best suggestion, if I had a family that called me requesting information of this, and I know it's just passing it on to somebody else, but the best suggestion I would have would actually be to contact, as I know Mark is very familiar with the Family Voices group in Nebraska, I would contact my Family Voices organization here in my state and get their feedback, because they know the laws a lot better than I do when it comes to education and what the schools are required to do. That would be the first place I would look. What is it? Are there laws out there within your state that you can use to the parent's advantage to ensure that those needs are being met? If I also know that our family advocate organization here, Families Together, if I come into cases where this might be the case, they can help with advocating with the family and going with the family as a support to help the family advocate for these needs. So I think that's also another avenue. Mark, I can do some more research and get back to you, and I don't know how we could do that with everybody on the call if you're interested in knowing that information, but I can definitely do some more research to find out if a deadlock does occur, what happens. And of course, as you mentioned, not all schools have that access to a school nurse, and if they do, it's even on a every other week kind of basis potentially. So I think that's another thing that we have to address as we move forward and look at our learning collaborative and what process and protocols. Is it something that the school nurse can help work with the family to create, but then allow, with it being set in place that if the school nurse isn't on site, who's gonna implement that plan and who's gonna be in charge of that? So those are things definitely to consider, and I apologize if I didn't answer your question in full. But I can do more research if you'd like me to do that.
There were two follow-ups to the question about the newborn screening, newborns to school age. Ann Riley in Kansas said that most the Head Start projects in Kansas have developed guidance for daycare and Head Start nurses. And then in Missouri, Sue commented that they have a program called Parent as Teachers, and it starts with 0 to 5. And other states may have a similar program in their state. And then we have one other question that is slash comment related to the challenges question. Deborah mentioned that a challenge that she would anticipate is any additional cost of participating in implementation, at least from the Department of Education perspective.
Yeah, this is Melanie. I don't think that we are at a place where we can say too much about costs of implementation or funding for that matter, but I hope that anyone who might be interested in learning more would keep in touch with us, and we'll, of course, as the Learning Collaborative gets more solidified and planned, we'll have more ability to be able to answer those types of questions. Shona, do you have anything to add about that?
No, I think you're right on that. As far as the long-term implementation expenses, those will be more closely developed as the project runs its course. Yeah. And as we all know, projects change as more is learned, and so setting a price now or a cost expectation now might be premature. We have about 5 minutes left remaining, so I don't know what's next.
No, that's it. Yeah, I think with 5 minutes left, if anyone has any last-minute questions, they can definitely submit them still. But if not, our final slide is our contact information, and if anyone is interested in being involved, interested in at least just learning more, please don't hesitate to contact myself or Heather, and we'd love to be able to answer any more questions or keep you in the loop as things progress. Heather, do you happen to have any last-minute comments for the group?
No, I really want to thank everybody for participating today and for the really, really great feedback and comments. And, you know, even a lot of times people are like, oh, I don't like hearing concerns, but I really want to hear the concerns of what we might have that we might need to look at with this project, because, you know, our ideas as our team has developed this project, we're not the only people that are going to be involved in this, and so it's really helpful to hear what other concerns you guys have and the feedback that you've given. And so if you are, you know, if you happen to be thinking about this and you come up with another question, another concern, or even just feedback you'd like to offer, please do let us know. Melanie and I are more than happy to get any kind of feedback and about this project. And as we begin to move forward, we'll be reaching out and letting all of you know that have participated today what the next steps are, and if anybody's interested in participating, we would love to have you on the Learning Collaborative teams and start working that direction. So we will begin working on that, I believe, after the first of the year, and get some of those plans as far as the Learning Collaborative lined out, and we'll hopefully be able to share those with everybody next year sometime, early next year sometime. So thank you all so much for your participation and feedback.
Yes, thank you everyone for your time.
Thank you everyone. You will all receive a follow-up email by Friday from this webinar, so we appreciate your participation and hope to hear from you soon. Thank you.
Thank you, everybody.
Thank you.